went to the University of Iowa, and I originally started out with a different major, but as I was in that major, I was able to be a part of an organization called Dance Marathon. And within Dance Marathon, I was able to volunteer at our local children's hospital within there. And while I was volunteering, I was able to be on a floor with one of the child life specialists, and I saw how that they were interacting with the patients and families. And it really sparked my interest because I knew I wanted to work in the medical field. I wasn't exactly sure how, but as I saw them build relationships with families and saw the part or the role that they played with the patients, I knew that that's exactly what I wanted to do. So I did my undergrad there, and I got, so that was my major, was in child life. And then my practicum was also at that same children's hospital. We were able to go to multiple different units and be able to interact with the child life specialists and the patients and see more procedures and just be a little bit more involved in that way. After that, I did my internship at HSHS St. Vincent Children's Hospital in Green Bay. And I absolutely loved it. It was 2 different rotations. I was on the pediatric hematology oncology clinic, and then I was also on our pediatric floor as well as our PICU. And I felt like it just really encompassed everything I was looking for when searching for child life. So I'm super grateful for that, and thankfully was able to be able to continue at that hospital and have been there now for almost 6 years.
That's awesome.
I still am in that hematology oncology clinic. I am still also on the pediatric floor in PICU, but we have grown in the fact that we get consulted everywhere else in the hospital. So we are a children's hospital within an adult hospital. So we are able to go to the emergency department. We're able to go to radiology and surgery. We're able to go to the adult floors and work with children when a parent or grandparent is newly diagnosed, or maybe they have a new prognosis. So we truly get consulted everywhere. I also was able to start a program at our local affiliated sister hospital across town. And I started a program over there in our surgery department. And now it has increased to be, again, getting consults from all over the hospital. So we worked even with labor and delivery. We've worked with the ED over there, and then we've also worked again with children of adult patients. So our program is definitely growing, and it's super exciting to be able to be a part of that entire process. I think the biggest thing is, one, to have that passion. The child life journey, I guess, per se, is, they're increasing the requirements for it, but I also think it can be a really good thing. But part of that is also still creating your own way of doing it. And part of that is being flexible. I think that it's important to really know that you really want to do this and you're willing to do whatever it takes, but knowing that you kind of are in the hands of other people too, and just being flexible in that way too. And that just shows that you are passionate about what you want to do, and that you are passionate about child life. Mm-hmm. I think it's really important to be present in those moments and take every aspect of it in, because when you're in a room with a patient, there's so many things that can be observed without even realizing it. I think a lot of our job is that assessment piece. And I think sometimes we do it without even realizing, but really trying to be present in those moments to take everything in and being able to learn every aspect of it. I obviously think that you should work with children in a hospital setting of some sort. I think any hospital setting is going to be appropriate, just for the fact that child life is evolving and working in different departments. So it's not just solely on a pediatric floor anymore. Mm-hmm. And so it's really cool and exciting to see those new units or different units than what are typically on an application. Mm-hmm. I think any sort of camp, or even alternative setting, as in like a bereavement camp, or even, I know we have, when people work with kids with special needs, that all just goes to show that you're looking above and beyond of what like a typical student would experiences that they would have. And so I think really anything that you can do working with children who are in need of some sort, I think is really appropriate.